to the Genius class one more time. We're going to go to the next scenario of ours. So let's share the screen so we go straight to the scenario. Okay, good. So here we go. So our next scenario we're going to be looking at is the ADHD. That is the attention deficit hyperactivity disorder. Attention deficit hyperactivity disorder. In this particular case, you're an FY2 in a GP surgery. You're seeing a 19-year-old who has presented some concerns. Your task is to talk to the patient and address the concerns. Now, if you look at the patient information in this particular case, okay, so the patient information. So this is a young boy, 19 years of age, as you can see. Okay, he has got attention problems, and this is why he has consulted. So he has consulted for several reasons. One, first of all, you know, he is sitting, shaking in the chair, looking everywhere. Why? Because he's distracted, you know, attention problems, distracted. So he's acting out, showing you that he's distracted. If somebody passes by, he will turn, he will look, you do other stuff. Yeah. So demonstrating it in front of you. He's shaking, he cannot sit comfortably, relax. Now, why has he come in? Well, people can come in, most common reasons is a school asking the child or asking him to go and see the doctor. So the school teacher told him or told you to see a doctor because they feel that you are lacking concentration during the lesson. So concerns from the school. That's one way they may present. The second way they may present is the patient has approached the nurse at school himself complaining that my concentration is lacking, and they have directed it or signposted to go and see the doctor. Or he may also come directly himself to the doctor and say, I feel like I'm lacking concentration. Or he may go to the school nurse and say, he's lacking concentration. Then they'll signpost him to go to the GP. Or the school themselves, they may notice and say, okay, I think you lack concentration. Can you see your doctor about your concentration? So we need to find out, you know, how they have come in. Has somebody referred them, or they just come in on their own? So in this particular case, he may come in for different reasons. Now, as we said, one of the things is when patient is sitting in front of you, there is a body language to read. Is he shaking? Is uncomfortable, looking left and right? It's because he's getting distracted with anything that is happening around him. Okay, good. Now, so what else will you find in the history in this particular patient? Yeah, what else will you find in the history? You'll find that generally, you know, looks unsettled when he's sitting in a chair. He looks unsettled. Okay. Throughout the consultation, yeah, and the main history is what we have discussed here, what they have presented. He also has found himself that he knows himself that he does lack concentration, and at time, you know, he forgot a pan in the oven. Yeah, he likes cooking, and he did forget a pan in the oven. He is struggling in school with any exercises that need a lot of concentration. Struggling in school with any exercises that needs a lot of concentration. In particular, he likes mathematics, but not other theoretical stuff that he needs you to pay attention to small details. So he likes activity, he likes practical classes, yeah? Likes practical classes. So what's his favorite subject? Mathematics, because he's doing something. Theoretical lectures or lessons, does not like them. He's currently living in a hostel because he's 19 years of age, he's at a uni, okay? He has always been finding it difficult to concentrate since primary school. Yeah, so which means for a long time since primary school. Okay, his parents do not think there's anything wrong with him, and therefore nothing has been done because they didn't think there's anything wrong with him. But he also found himself forgetting things easily. He'll forget, of course, some important events. Okay, and of course forgetting when cooking. Okay, so these are the things that has concerned him, and this is why he's here. Approach to this particular task. What's going to be our approach? Yeah. Now, adding to that history is normal. Is other than that, is he fit and well? No medical problems. His mood is good. 8, 9 out of 10. Okay. Is he sleeping well? Has no sleeping problems. No regular medications. No allergies. Yeah. He does forget from time to time school appointments because of concentration. You know, he makes friends easily in class, and sometimes friends, they do help him with the schoolwork, with his lessons. Okay, good. So, approach to this particular task. You take the history of the presenting complaint. So what's the presenting complaint? Why did you go and see the nurse? Who was referred in here? Because I lack concentration. So we're going to take the history of lack of concentration. In other words, this lack of concentration is what? Inattention. So we're going to take the history of inattention. Yeah. So we're going to be looking at the inattention symptoms. Now, so to begin with here, so what are the questions that you need to ask about inattention? So first of all, let's ask about the presenting complaint. What is it? Lack of concentration or inattention. So we're going to be asking, what do you mean by lack of concentration? Can you tell me a little bit more what you mean? That's one. And when did you notice that you do lack concentration? The presenting complaint. What is it? How long have you had it? When did you notice it? Can you describe situations where you lacked concentration? Can you describe situations where you lacked concentration? Has anybody made comments about your concentration? Yes, my school teacher has made comments about my concentration. Okay. If yes, okay, who has commented it? And how is his performance at school in that particular situation? How about school? Has anybody commented about you lacking concentration during the lessons? Okay, we need to be asking that as well. So this is about he has come into concentration. Now that tells us we need to be asking more about the ADHD symptoms. Now, generally, there are two symptoms of ADHD or two groups of symptoms that we need to ask. What are the two groups? Inattention symptoms and hyperactivity impulsive symptoms. Yeah, inattention symptoms and hyperactivity impulsive symptoms. Good. So let's look at inattention symptoms. What type of things can we ask? Well, first of all, we can ask about making careless mistakes. Inattention. Yeah, we're going to be asking about making careless mistakes. You know, does he make careless mistakes? Okay, so let's share a slightly different slide so that we can. Just a second. Okay, so we need to share, we need to talk about inattention symptoms so that is clear for us what symptoms are inattention symptoms. Okay. Okay, I'm going to share the screen again. So we have asked about the history of the presenting complaint, which is one, the history of what he has presented with. What do you mean by lack of concentration? When did you notice that you lack concentration? Can you describe the situation where you lacked concentration? Has anyone made comments about your lack of concentration? If yes, has anyone commented on his lack of, who has commented, yeah, on his lack of concentration? So here, guys, we are supposed to say who has commented, okay? If yes, who has commented? Yeah, so remove that. Good. Are there any situations at school where you feel that you lack concentration? Himself now, insight into the problem. He will have. So let's ask about symptoms of inattention. We say there are two symptoms. There is one, inattention symptoms. Yeah, there's one, inattention symptoms. And then there is a hyperactivity symptoms. Now, inattention symptoms is lack of concentration. So here we can ask, do you feel that sometimes you fail to give close attention, failing to give close attention to detail or making careless mistakes in school? Do you feel that sometimes you fail to give close attention to detail or make a careless mistake in your schoolwork or in other activities? The next one is maintaining concentration. Do you have difficulty maintaining concentration when performing tasks or activities? Okay. Do you have difficulties maintaining concentration when performing tasks or activities? Can you give an example of a situation when this happened? If he answers yes, then you have to ask further. That is inattention symptoms. What else can we ask? Difficulty in organizing tasks. Do you have difficulties in organizing tasks and activities? reluctant or dislikes or avoiding tasks that needs concentration? Do you sometimes feel reluctant or dislike or avoid tasks that require sustained mental effort? So avoiding tasks that requires mental effort. Yeah, losing items. Do you tend to lose items necessary for tasks or activities such as pencils, mobile phones, or wallets? Yeah, that's lack of attention. Do you tend to lose these items? Easily distracted. Do you get easily distracted by activities happening around you? And we mentioned that when you're sitting in this station, you'll be looking lefty because if somebody passes, it just gets distracted. You have to register that. So for you, it's important to say, oh, I just saw you looking on the door. I saw you looking on the window. Is there something you're looking at? He may tell you, oh, somebody passed it and it distracted me. Okay. Do you tend to be forgetful with regards to daily activities? Yeah, being forgetful. Okay, being forgetful. Yeah, need to ask about that. Do you tend to be forgetful with regards to daily activities? Has anyone at school ever mentioned to you that you do not appear attentive? So not appearing attentive in lessons or doing something. So these are inattention symptoms. Yeah, making careless mistake, failing to give close attention to detail and making careless mistake. Like difficult maintaining concentration when doing activities. Okay, if yes, let him tell you situations. Difficult in organizing tasks, reluctant or avoiding tasks that needs mental effort, losing items easily, pencils, mobile phones, getting easily distracted by activities happening around you, forgetting things easily, some, not appearing to be attentive when doing something or when somebody is showing you something. Okay, so those are the stuff about attention problem. Now let's ask about symptoms of hyperactivity symptoms. Okay, now hyperactivity symptoms. Do you tend to be fidgety? Yeah, fidgeting with things around you. Do you tend to be fidgeting with the things around you? You touch a pencil, you keep playing with it, so cannot sit calm. Yeah, fidgeting with things. Do you do activities such as tapping hands or feet or screaming when seated? So when you're sitting down, can't just sit, moving around, shaking around, tapping hands, tapping feet. Okay, so that's hyperactivity, impulsive symptoms. When playing games, do you ever experience difficulties waiting for your turn? When you're playing a game with somebody, do you find it difficult to wait until it is your turn to play? Do you feel that sometimes you interrupt others when talking? So interrupting others when talking. Do you feel that sometimes you talk excessively? So talking excessively. Do you sometimes fail to follow through on instructions or to finish tasks? Do you fail to follow instructions? Do you fail to finish the task? Blasting out answers before the question has been completed. Do you ever blast out answers before somebody has finished asking you? Finding difficult to play or engage in leisure activities quietly. Do you ever find it difficult to do something or to engage in activities quietly? Okay. Has anyone ever mentioned that you appear restless? So this is hyperactivity symptoms. One more time, fidgeting with the things in your hands, tapping on your hands, on your feet, okay? Difficulty waiting for your turn when you're playing games with others, interrupting others when they're talking excessively, failing to follow instructions or failing to finish the task, blasting out answers before the question is finished, finding difficult to play or to engage in leisure activities quietly. Okay, anyone ever mentioned that you appear being restless? Okay, so these are hyperactivity symptoms. Okay, so now that we have looked at hyperactivity symptoms, the next thing that we're going to have a look, we look at the criteria. What are the criteria for diagnosing diagnosing the condition, yeah, ADHD. 1 second, my slide is lost here, trying to find it at the same time. Screen, let's load the screen. Oh, yes. So here we go. I'm gonna share the screen again. I think I didn't share it properly. So just make sure we understand this. Share the screen. Yeah, the screen is shared. So what are the criteria for making a diagnosis? Yeah, criteria for suspecting ADHD. Now you need at least 6, but 5 in adult. Yeah. So let me correct this. This is 5 in adult. Okay. 5. Yeah. In children, at least 6, in adult 5 of inattention symptoms. You know those symptoms we discussed? We need 5 in adult, 6 in children, at least of them. At least 6, again, in adult 5 of hyperactivity symptoms. So you hyperactivity, impulsivity symptoms. So you need both inattentive symptoms and hyperactivity symptoms. Symptoms should have started before the age of 12. He told you, this particular patient of ours said he has had these symptoms since in primary school, which means way before the age of 12. Okay. Occurred in 2 or more settings. Yeah. So these problems must be appearing either in 2 situations, at school and at home, or at work and at home. So at least in 2 settings. Yeah. Good. What else? Has been present for at least 6 months. So you need to have it for a long time, 6 months or more. Yeah, of course, he has it for years. Clearly interfered with or reduced quality of social, academic, or occupational function. It must be affecting the schoolwork or the work generally, or daily activities. Not occurred exclusively during the course of a psychotic disorder and are not being explained by another disorder. So these things or this behavior should not be explained by any other mental health condition or psychotic disorder, or just not to be explained by anything else. Then you can suspect ADHD. Yeah, good. Now, so which means these criteria, if I'm going to go back to summarize, 5 of inattentive symptoms, 6 inattentive symptoms, 6 hyperactivity symptoms, at least before the age of 12, must be occurring in 2 situations, at home and at work, or at home and at school, symptoms present for 6 months or more, interfering with daily activities, and it must not be explained by any other illness. Okay, so we need to be asking these questions. When did the symptoms start, to check that it was before the age of 12? Do you experience similar symptoms at home? Because he mentioned that at school, he had the problem concentrating. Yes, he has same symptoms at home, similar problems at home. What happened at home? He left a pan in the oven. Okay, does it affect the school, affecting the daily life? Do you have any mental health condition? To check it, no other thing that may explaining his symptoms. Now think about differential diagnosis in this particular case. You need to think about differential diagnosis. So what could it be? What else we should be thinking of? Anxiety disorder can make you anxious, agitated, yeah? But the patient usually, is there anything you're worried about? Ask, is there anything you're worried about? Anything stressing you? No, there is nothing. In anxiety, there will be a stressful situation, and they'll, always be worried. Depressive disorder, ask about mood, low mood, lack of energy, poor sleep. This particular patient has no sleeping problems. Autism spectrum disorder, there will be other things. There will be language problems, failing to talk properly, playing around, not interacting with others. He makes friends easily. He plays with friends. So it's not the autism. Personality disorders, yeah, we need to think of personality disorder or bipolar. All these things are differential diagnosis. Remember to complete other histories, yeah, the PMAF-TOSA, the ICE, the effects of symptoms. We did ask already the effects of symptoms during that history because it's important in this particular condition. Then social history. Are you in any relationship? Yeah, we need that. Who else is at home? Okay, friends, hobbies. We need all that, yeah? Now, in terms of the effects of symptoms, we need to be asking here, like, do you drive? If it's driving, any record or offenses of dangerous driving, because if they drive and they have activity, they may do dangerous driving, yeah? Any record or offenses of dangerous driving. How is your progression at school? So when you're asking for the impact, ask about progression at school with the schoolwork. Do you cope with the schoolwork well? Are you able to do activities such as shopping, whatever, on your own? Are you in a relationship? If yes, then ask if they're having excessive disagreement in a relationship. With the hyperactivity, they may be, usually they may have a problem in the relationship, yeah? Having arguments, excessive disagreements. Okay. Does he have friends? Yes, he makes friends easily. Okay. Any problem sleeping? No sleeping problems. So that is in terms of the effects of the symptoms. Yeah. In terms of the effects of the symptoms. So let's recap that from a different document. I'm going to recap that from a different. Yeah, we looked at those ones already. I think when the screen is shared, it's difficult. So the screen must not be shared. Okay, just a second. Just loading slowly than usual. So we said the effects of symptoms. Ask about driving, okay? Ask about driving, ask about progression at school, okay? Ask about activities at home, okay? Ask about making friends, ask about relationship, ask about having maybe excessive disagreement with a partner if they are in a relationship, okay? Good. Of course, we have to look at the diagnosis. We have to explain that you're suspecting that they may have what we call an attention deficit hyperactivity disorder. Okay, it looks a very big term, but it simply means a situation, a condition in which you lack attention, and sometimes you may be more hyperactive than normal. Okay, you lack attention, it affects your concentration. Okay, it's called attention deficit hyperactivity disorder. It affects a condition which affects you in such a way that you find it difficult to concentrate. Sometimes you find it difficult to stay calm. You feel a little bit agitated. That's all what it is. Yeah. So what do we need to do in this particular case? We need to, of course, refer to the mental health team specialist. Why are we referring? We're referring them to confirm the diagnosis. Yeah. They want to confirm the diagnosis. And once they confirm the diagnosis, they will be able to offer a treatment. Yeah. So let's explain. What will the specialist do? The specialist will confirm the diagnosis once we refer you. Okay. The specialist may offer you what we call group-based support. Group-based support. Here you will be educated on the causes and the impact of ADHD. Yeah, you may talk more, given more information about what ADHD is and how it can affect you. Okay, you can also attend with what your parents as well. Okay, and the parents will also be taught about some strategies on how to assist you. Okay, of course, you need to liaise with the university. If they have expressed concerns, we're going to liaise and discuss with them. Maybe also explain a little bit more about your condition so that they can understand you and you can be given what? The support you need at the university. What else the specialist will do? The specialist will give you some medications. If they confirm this condition, they will give you a medication called what? Methylphenidate. Yeah, the methylphenidate. This is the first line medication. Yeah, so this medication may help. Sometimes if this medication is not very helpful or it's not very effective, there are some alternatives. If that does not help, then they can try some other medications as well. You don't have to mention to the patient the names of the medication, yeah? But you can mention the first medication, the methylphenidate, medication called phenylphenidate is usually used as a first line. If that does not help, they can try some alternative medication. Avoid bombarding the patient with a lot of names of alternative medication. Okay, so if we are to go back again, what will happen here? Explain that he has got an attention deficit hyperactivity disorder condition. It's a condition which affects the concentration, and you may find it difficult to do tasks such as being attentive during class, and forgetting things. Yeah, it affects concentration. Okay, you're gonna refer them to the mental health team, the specialist, for confirming the diagnosis and for treatment. what the specialist would do, they would, of course, ask them questions about their condition. They would confirm the condition. They will offer them treatment or management, such as group-based support, where they will go, of course, get information about ADHD, give them more information about it and how they can be affected, how it will impact their lives. And also you should attend with the parents. And also the parents also will be given information and education about how they can assist him. We'll liaise the university so that they can also put measures in place to assist you, as long as he's happy with that. If the specialist confirms that's a condition, they'll give you medication because